underway. So I know we've had a lot of interest in the workshop, and we have had a lot of people register, so I imagine that there will still be a few more people joining over the next minute, but I will just kick off. So I would like to begin by acknowledging the traditional lands, the many lands that we're all meeting on today. For me, that's the Gadigal people of the Eora Nation, and I'd like to pay my respects to elders past, present and emerging, and I would like to extend that respect to all Aboriginal people joining here today. As I mentioned, we do have a lot of people who have registered to attend. There's been a lot of interest. There's also been some last minute changes as a result of the flooding, both for participants and for presenters. So we've made a few last minute changes, but I hope that that will all still work well. Just to briefly introduce myself, my name's Sian Rudge, and I'm the head of the Evidence for Action Division at the Sax Institute. And my role today will be to facilitate the session. I would like to thank everybody who's joined today. We do have participants from our Sax member organisations, from a number of Aboriginal community controlled health services, from the HMRC and from New South Wales Health. Thanks for people who completed the survey. That was really helpful as we're thinking about what would be useful for this session. And we have drawn questions from the questions that have been provided today. Provided through that survey. Because we have a large number of people, we'll keep everybody on mute, so you can put questions into the chat function and we'll monitor that. I know a number of people will have useful resources and tools, so as there are questions that come up, if you have things that you think would be helpful, feel free to put that in the chat function as well. We will circulate that around afterwards. I'm just seeing a few people are saying they haven't got sound, so I'm just going to pause a minute to check in with Amanda or Melissa to see if there is anything that's a problem here that I can do anything about, or if anybody can do anything about.
The sound seems to be working, Sian, so apologies to the people who are unable to hear us. Perhaps if you disconnect and reconnect, that might work.
Okay, thanks, Amanda. The old restarting, that often seems to work. So if you can just leave the meeting and come back in and see if you can join. So as we're talking about that chat function, though, if you would like to introduce yourself that way, that would be great. It's always good to know. I know it's a little bit different when we're doing things online, but I know we're all quite familiar with this format now. It's quite nice to hear from participants through the chat function. So if you're happy to introduce yourself, say hello, say where you're from, that'd be great. So I mentioned we had some late apologies from speakers and participants who've been affected by flooding. So our thoughts are with them as they're managing through some difficult times. And I know quite a lot of you are managing with rain one way or another, so I really appreciate those who've made the time to join today. And I know that this will be a useful session. So as I mentioned, this is a Sax Forum event. So very briefly, the Sax Forum was established in 2020 to help the Sax Institute and its more than 60 member organisations better connect and to develop further collaborative opportunities. So initiatives identified by our members so far have been on support for early and mid-career researchers and understanding more about research co-production. This work on working collaboratively in Aboriginal health research was one of the things identified by our members early on, and we're really pleased to now be having a look at that. This will be the first workshop looking at working collaboratively in Aboriginal health research, and we have at least one other session planned and possibly more. This first session is really a bit of an introduction to working in Aboriginal health research, and we have a focus on designing a research study that is community driven, getting the question right, and working with Aboriginal communities. In the next sessions, we'll appreciate your views on what will be really helpful for you as you are continuing to work in Aboriginal health research. We know from the survey that a number of you are already working in Aboriginal health research, and there are things that have worked well for you and some things that have been challenges. So there will be things that we can, through this forum, explore a little further. So just some practical information about the session. As I mentioned, just because of the way this is set up, your cameras will be off and you will be muted. So just use that chat function, both to ask questions as well as to put anything in there that you think will be useful, and also to introduce yourself. So again, we're really pleased that so many of you have been able to join today. I'm sure this is going to be a really informative and useful session. I'm also extremely pleased to welcome our panellists today. I'll introduce each of the panellists before they speak, and I'm sure many of them will be known to you already. So our first speaker today is Simone Sharif, and Simone is a Wotjobaluk woman and who has worked at the Sax Institute on the study of the environment on Aboriginal resilience and child health, also known as SEARCH, for over 8 years. So Simone has experience in the Aboriginal community controlled health sector in New South Wales. She's worked in Aboriginal health research and in the implementation of services relating to ear health and speech and language development in urban Aboriginal children. And Simone herself is an early career researcher and is currently undertaking a PhD looking at the trajectories and risk factors of overweight and obesity in rural urban Aboriginal children. And also, Simone is at home with a sick child right at the moment, so you might see a small person pop up from time to time, and we'll see how we go with that. So I'm sure you all appreciate the challenges of multitasking and juggling various things, including physically juggling a baby. So thank you, Simone. I really appreciate you stepping in at short notice, and really interested to hear, yes, there we go, the aforementioned little one. So thanks, Simone. I will hand over to you and see how we go. And I think you just need to unmute. There we go.
Yes, thank you, Sian. I'm here with my assistant, Kai. Yeah, first I would like to acknowledge the traditional custodians on the land that we're all meeting on today, and I'm dialing in from Wiradjuri country here in Wagga Wagga. And as Sian said, I'm a Wotjobaluk woman, and oops, hold on, I'll just try and share my screen. Okay, hope that's working for everyone. So yes. Yeah, oh, it is working. Did someone say? Yes. Excellent. Thank you. Yeah, so first out, I wanted to talk about, designing a research study that is community driven. And so I think, in the past and even still a bit now, research has been done by non-Aboriginal researchers within an academic institution, and they've determined the research questions, the method in such that how the research is conducted, as well as the interpretation of all the findings and also the research outcomes. And so I think for research that is community driven, the approach for that, is one that fully engages the Aboriginal community in all stages and aspects of the research process through like a co-creation process. So from the beginning, from setting out the research agenda, understanding the community's needs and priorities, identifying the research questions, interpreting and disseminating the results, and also understanding the way in which the community would like to, use that research, and if there's any areas around, research development or capacity that they're interested in doing. Yeah, and I think it should also, we shouldn't be doing research just for the sake of doing research. It should be for a purpose, around priorities that the community want to do, and also, for a purpose that's going to, lead towards like programs and services that are going to help with the health and well-being for the local community. And I think, sorry, my assistance isn't very helpful. And I think that, in the past, researchers, they wanted to, come in and, they talk about wanting to, collaborate with Aboriginal communities, but it's often like a one-way, or it's quite a tokenistic collaboration. And so I think, researchers need to, go out with an understanding of actually, fully working with community and adjust their research. If you have a research idea, and you want to go to communities and find out whether, that is an idea that works for them, I think you need to be willing to, adjust what you think you might want to be doing for the research and what actually the community wants to be doing. Oh, gosh. And as I said before, it must demonstrate, like, what services or programs or funding or what value it's going to be able to bring to the community. We don't want to just, there's so much research, like why we you need to make sure there's actual benefits coming back to the community. Oh my God. And then, yeah, so I think the way you do this, I think, in terms of finding out what communities' priorities or research agendas they want to look at, I think the best way is, being able to, build those connections with community. To be able to build trust, you need to go out there and just sit down and have a yarn, a cup of tea with community and talk about them and build those relationships first. I think too often, researchers go out there with their formal agenda and they just want to get down to business and get the research done and everything. And so I think it's really important to have those more casual interactions, I suppose, and build that connection and trust with the community and listen to communities, what they want to do. And then from there, you can, speak with them about what their priorities might be, and if that aligns with what you were hoping to do, or maybe you need to change what you were looking at originally doing, and develop the research based on the priorities of the communities. Do this through the local Aboriginal Medical Service, or if you're in New South Wales, with the Aboriginal Health and Medical Research Council, which is the peak body for AMSs in New South Wales, because our AMSs get requests constantly, like every week, from researchers wanting to do research with them. You can't do everything, and communities don't want to be part of research where there's going to be no benefits. They, people just coming in and taking their information and not actually, engaging with them and co-creating it with them. And so getting the questions right. So I think in terms of the research questions, I think it's important for the questions to, be specific, feasible, and, discover something new that can be answered in an ethical way. But I think, as I mentioned earlier, these questions should be, developed by the community or with the community. And be relevant to the needs, as I previously said, for whichever community you're working with, and have, be driven by that community, like there. And then, oh gosh, sorry. And then also, once you've designed the research questions, I suppose, once you're looking at the methods in which you want to undertake the research, working with community to find out for that community what's going to work best for them to be able to, which methods are going to best be able to answer these questions. Some of the communities that we're working with, like people have been wanting to do, use like yarning circles as a method to be able to best get the research questions they're wanting to do. As I said before, no research just for the sake of research. It's what is actually going to be a benefit for the community. Like, people, communities, like, it might be good for the researchers. The benefit for the researchers might be they want to, have a nice research paper published that looks good on their resume and things. But, that's not a priority for community. We want to see, like, services, programs, funding for our communities for programs. And so I think, you know, when you wanting to work with Aboriginal communities, I think every community is different. So I think what works in one's not going to work in another always. So, you know, so I think it's very individual, and I think you need to, you know, go out and get out there in the community and speak with people. And I think, you know, you need to be respectful and, you know, have an active engagement with the communities. As I said before, like just going out there and connecting, sitting down, having a cuppa, getting to know people, them getting to know you and what you're about and what you're wanting to do, and then engaging the right people in community across all the steps in the research process. Sorry. And also, you know, make sure that you're respectful around privacy, confidentiality and cultural sensitivity are taken into account, you know, because people are sharing, you know, often quite sensitive information with people, and they're worried, like, you know, too often in the past, researchers are coming in and taken our information, gone and done whatever they want to do with it, write it up, and, you know, it's not always reflective of what's actually happening in community. And so, oh, I know, Bubba. Sorry. And also, as I said before, the trusting relationships are really important. Yeah, I think, yeah, that's a really key thing. I think it's like important with any relationship to build trust. You know, without trust, it's hard to work together. And I think research works really well when you know, being able to build that good rapport and those good connections and relationships between the researchers and the community. And, you know, this takes time. It's not something you can do just by coming out and having 2 formal meetings. Like, you have to put in the time and effort to build that rapport, but in the long run, it's really beneficial and leads to, you know, better engagement and research. And I think, as I said before, about involving the right people in community, like go out and speak with the Aboriginal Medical Service and find out who would be best to be involved in this research project. You know, they're the experts for their community. They know what's going to work and what's going to not work and how to best approach it. Okay. Yeah, and I think another important thing is, I think, you know, research always seems to, you know, it's always about valuing, you know, Western research methodology and knowledge, and often, you know, you see, you know, researchers not valuing Aboriginal knowledge and wisdom, and, you know, in terms of just interpreting data. You know, I've heard from some people in community about they were involved in a research project, and the researchers came out and they did some, you know, collaboration, they were calling it, with the community and things, and then when it came time to write up the research findings, they were like, oh, no, you can't be involved in that, you know, you don't have research experience or you don't have a PhD. And so I think, you know, there's many examples of that. So I think it's about you know, you as a researcher valuing and seeking that input and collaboration with the communities about how to interpret the findings, their research, their information from their community. And this also, you know, helps with, you know, the mistrust and ensuring the data is of a high quality and it's reflective of what's actually happening in community. And it also adds a richness and context to the research that, you know, you can't get otherwise. Yeah, and as I said before, really important to always listen to Aboriginal community members, and their voices should be valued and privileged throughout the research. Hey. Gosh. Yeah, and I think also as researchers coming to communities, I think you need to, you know, understand the, you know, the impacts of colonisation in the past and both still today. You know, and people have a lot of fears, rightly so, about, you know, who's wanting to access the information, what are these researchers going to do to it. And so I think being really clear and upfront and having those frank discussions about what the research is, who's going to be accessing it, even down to, like, yeah, memorandums of understanding, like, you know, how much funding is going to be given, who's going to be doing it. Hey, it's okay. Yeah, and there's, you know, people and having, I think, important as well about having Aboriginal staff and researchers leading in like key leadership positions in the research and leading the research. And I think, you know, a lot of times researchers or research projects by unis and other places, they're like, oh yeah, we've got an Aboriginal person working on the project, but, you know, it's kind of a bit of a tick the box sometimes, like they don't have local people that are known in the community or, you know, been working in that community. And so I think sometimes it's not enough just to have any Aboriginal person working on it. I think you need to make sure you have the right people. And my assistant isn't very cooperative, I'll tell you that. Come on. Yeah, and as I'm sure all of you know, in the past, research has been, you know, done on us and not with us. And then, you know, yeah, and so I think this past, and it still happens today, obviously people are, you know, researchers from universities and things, I suppose, want to come in and do research with our communities. And so I think, you know, people in community feel quite hesitant and cautious around participating in research. And so I think you need to, you know, understand how you're going to, you know, the past of what's happened in research and understanding that, and you know, so you can understand where community is coming from and make sure that you're not doing those same mistakes that's happened in the past. Okay. Yeah, and as I was mentioning before, the importance of building that trust with community and having those frank discussions, you know, to understand better their priorities, and also with communities, like you know, researchers, I think sometimes you know, live in a different world where yeah, I think, you know, community timelines or what's happening at the Aboriginal Medical Service might not align with what the researcher or even the funding timelines are going to be. And so I think being flexible and having those discussions with community, yeah, and again, like when you build that trust, people can come to you and yeah, let you know what's going to work for their community. Yeah, thank you. Sorry, that was a terrible presentation. My assistant was not very helpful. Thank you, everyone.
Simone, that was absolutely extraordinary. I will let you kind of mute and
shame. Thank you.
You can turn your camera off too if you want to do that now, because we might just move on to the next speaker and come back to you later. So there was so much in what Simone had said. I'm not sure that I'm going to try and summarise all of that, but really encapsulated lots of the key elements that are important about doing this sort of work well. And if I could just draw out one thing that she said a number of times, it was about building trust. And I think that's probably important in all sorts of research, but it's even more so in research with Aboriginal communities who often haven't had the best experience with a previous research or with previous engagement with mainstream services generally. So yes, I'm agreeing with the comments that are coming through about Simone demonstrating some really extraordinary skills in both presenting and managing a sick child. So look, I'm going to pass on. I think Christine Corby is online, but I just would like to check that first. So Christine, if you're there, could you unmute? And maybe you can't do that. So Amanda, can I just check with you first of all if we've been able to sort out Christine's connection?
We're in the process of doing it, so perhaps if we can move on to the next speaker, and we're trying to sort that out.
Okay.
Thanks.
All right then. Well, sorry, it's just one of the things, you know, despite us doing this for a long time, there's always some last minute challenges. So we will come back to Christine Corby, but right now I'll go to Kim Morey. So Kim, thank you for joining. So really very pleased to have Kim join us today. So Kim Morey's family connections are from Central Australia. She's of Matiere and Eastern Arrernte descent. So Kim is Executive Officer and Platform Lead of Health System Research at SAMRI, and she's got extensive experience working with the Aboriginal health and housing portfolios within the South Australian public sector, and she does have an excellent knowledge of the health and wellbeing issues facing Aboriginal peoples, both from a South Australian perspective and at a national level. Kim is also currently Chair of the Aboriginal Health Research Ethics Committee of the Aboriginal Health Council of South Australia. So thanks, Kim. I will pass over to you.
Thank you very much. I'd just like to say thank you to Simone. That was a fabulous presentation, and obviously under pressure with her assistance. So thank you for an excellent presentation. I think some of the key messages that came through in your presentation, I think resonated with the work that we've been doing. And, you know, I think you'll hear some similar themes actually that Simone covered. So before I obviously kick off into the formal presentation, I'd also like to follow appropriate protocol, and that's to acknowledge the traditional owners of the lands and seas that we are all on across Australia, and for me here in Adelaide on the lands of the Kaurna people. And I'd like to pay my respects to the ancestors and to the elders, and acknowledge their ongoing spiritual relationship with this place that I've got the privilege of living and working on. And I'd also like to acknowledge the Aboriginal and Torres Strait Islander people and your ancestors that are online today. So just to give you a bit of context, so SAMRI, the South Australian Health and Medical Research Institute, is a fairly new institute in South Australia, less than 10 years old. And the Aboriginal Health Equity theme, or Wadli Paringa, is one theme of 4 in SAMRI. Professor Alex Brown has headed up our unit up until very recently. And so there's been a change in my title since probably we spoke, but Dr. Odette Gibson, who's now Associate Professor, and I are now co-theme leaders for the next little while Alex is moving on to another piece of work, a national piece of work. So we've got kind of 5 programs of work that we work in, and they're led up by our platform leaders. And so I look after the health systems and services area, and obviously underpinned by business supports and our systems. And I'll talk about how we arrived at these platforms throughout my presentation. So we've done a whole lot of foundational work in the early years of SAMRI, which I think has been really important, and I think an advantage because it is a new health and medical research institute, that we have been able to influence the organisational culture as the organisation has grown. There was originally 7 themes, and Aboriginal health has always been a theme in its own right. And we've been able to influence the organisation, like I said, as it's grown. So before we even kind of kicked off, there was a landmark kind of workshop that was convened in late 2012. And that was really to identify what the priorities for the Wadli Paringa Aboriginal Health Research Unit might be. And so we engaged with the Aboriginal community and with the health sector and service providers, policymakers, researchers working in Aboriginal health to kind of get a bit of understanding of what was currently occurring. At that time, there was a really strong call for some reform to be done in terms of how research had been conducted in South Australia, and also particularly around data and a greater control around data. From our community and from our stakeholders' perspective. And so this really commenced the work around the development of the South Australian Aboriginal Health Research Accord. So what I want to kind of cover off on today is to talk about how we've gone about implementing these principles. So 9 principles emerged through the development of the South Australian Aboriginal Health Research Accord. It's a document that complements the NH and MRC guidelines. But really, we wanted to be able to have a South Australian lens applied to that from a community perspective. So we looked at the existing literature around best practice in terms of Aboriginal and Torres Strait Islander research. We looked at, obviously the ethical guidelines, and then we engaged with our member services as well as the universities. And what we were able to do was to get agreement from the 3 major South Australian universities and our peak body, the Aboriginal Health Council of South Australia, to these 9 principles endorsed by our Council of Elders in South Australia. And so you'll see some of in the priorities, or the 9 principles here, some of the similar things I think that Simone was talking about in her presentation around priorities driven from the community, and from our sector, that there's we have equal partnerships, that there's more control from an Aboriginal perspective around our data and ownership around our intellectual property rights, that we must do research that is of benefit. We must respect Aboriginal ways of knowing and being, that we must have a translational plan, and that we have, good communication strategies, and that we have Aboriginal people involved in every part of our research. And so really this was the kind of setting the scene in terms of how we were going to do our research moving forward. The first kind of major project that we did, that we funded, was actually a partnership with the Aboriginal Health Council of South Australia, our peak body and NACCHO affiliate in South Australia. And so what we did was we funded a position and then set up a chief investigators group that really supported the sector. And we went out and asked the sector what were the research priorities or the public health concerns from their perspective. And so we undertook some qualitative interviews, and we had a set of semi-structured kind of questions, but we also did a retrospective audit of the previous 4 years of ethics applications that had been approved by the Aboriginal Health Research Ethics Committee. And we looked at things like, was it an Aboriginal-led project? What was the methodology? What was the research question? What was the topic that it was trying to address? And we also got a bit of an understanding of where, from a geographical perspective, where research had been done across South Australia. And actually what we did see was some gaps where there was, communities that hadn't been engaged in research at all, and others that, were experiencing probably a burden of research also. So that was a really important foundational piece of work for us to understand what were the things that were of concern to community. From there, that piece of work informed our program of work and our priorities. So it was those priorities that had emerged from the Next Steps project that informed our first program of work. So our focus was on chronic disease, psychosocial determinants of health, and disparity and inequities, and then underpinned by some of those key pillars around health services research, clinical research, knowledge translation, and capacity building. And so really we were trying to put into practice what we said was important from the South Australian Aboriginal Health Research Accord. So this is another example of where we were able to look at, obviously diabetes is a big concern in the Aboriginal and Torres Strait Islander population, and it certainly is in South Australia. And so even though that our foundational work was telling us about what our public health priorities were, and diabetes was one of those, we still then went back to communities to undertake consultation to say, this is what we think we can do to try and understand diabetes in a South Australian context, and to understand what are the kind of biomedical markers that might be driving disparities and complications in diabetes from a South Australian perspective. So we went, before we applied for funding, we applied for ethics approval, and then we went out to community to say, we've got this study that we would like to undertake. Does the community support it? Do they think it's important? Because we would need to attract about a quarter of the South Australian Aboriginal population into this study to understand the complications of diabetes. And so we did that across South Australia. So we did the engagement, like I said, across South Australia. We wanted to understand the causes and consequences of diabetes. How could we influence services? And exploring really the social and environmental and biological risks that are creating the disparities in what our people are experiencing through diabetes. And so this was a way that we could demonstrate that we were actually doing research that was of benefit and priority to community. Our next principle is around partnerships and developing mutual trust and equivalent partnerships. And so this piece of work was a large Centre for Research Excellence in Aboriginal chronic disease and knowledge translation and exchange. And so what we did was we partnered with the community controlled sector and set up a national reference group that really provided oversight into what were the things that were important to the sector's perspective that they wanted to understand. Originally, we thought we'd do a whole lot of kind of evidence gathering, systematic reviews and inform the evidence, but actually the sector said, and have a focus on chronic disease, but the sector said, actually, this is what we need to understand, but better around governance, best practice care, sustainable funding models, accreditation. So the whole program of work really was informed and changed through those partnerships and developing a trusting relationship across those services. All of our work is underpinned by involvement of Aboriginal community in our work, and so our work's guided by Aboriginal reference groups, and community are involved in our study design, help us with identifying, data, how we collect it, inform the analysis of our data, help us with interpretation, and how we would report that. And so these groups really have been very important in some of the policy work that we've also done, and also in some of our studies, in, like I said, NAT co-design. And so, this is a demonstration of how we would have community involved in various projects. And most of the community members have an interest in the topics that we're studying, and therefore they've got a lived experience and bring that to the table through the research that we're doing. This is some more photos and images of our community members that provide that oversight in various ways, and endorsement to our processes, and keep us on the straight and narrow to ensure that we are also following appropriate protocol and cultural protocols. An example of the ownership principle and how we've been able to implement that in one of our projects. As I mentioned when I was talking about the early work that we did around our foundational work, one of the priorities was that our communities wanted more control over data. And this probably won't be any surprises to anybody that works in Aboriginal health, that our data is often, we have comparisons of, rural, remote, and urban communities, but communities don't actually, they know what's going on in their local communities, but don't actually have access to the data often. And so this piece of work has been led by Odette Pearson, and what we've done is we've based 19 landscapes in South Australia where Aboriginal people live, and then we've drawn together about 9 data sets into these landscapes, and then we've worked with community around how they might want to use that data and use it for planning purposes, and they have control over how that works. So initially we've had really big reports, but now what we're trying to do is to put it into an app so that our communities can access them in real time, and they've got the evidence base at their fingertips to advocate for systems, policy, funding, and leverage change through their own data. And we are really just kind of pulling it together, but they really are the custodians that utilise the data. The communication principle was really important, and I mentioned the Aboriginal diabetes study, and we obviously have very remote communities in South Australia, with language being still very strong in some of those communities. And the Aboriginal diabetes study is a kind of a complex study to understand, so we really wanted to ensure that our communication was relevant, that people from remote communities could understand what the study was trying to do and how it would use the gift of their samples in the study. And so we were able to translate our consent forms and do some videos and things into language, into Pindara. So people from those remote communities were as informed as, someone coming from an urban community around what the study means, and to give informed consent. The control of the control principle, what we've tried to build into the Aboriginal diabetes study is, people are gifting us their samples of blood. And so what we've done is established a governance structure of Aboriginal community members to help provide oversight to how those samples are cared for and looked after. And that's a really important part of the work, because when we did the consultation with communities, those were questions that communities were very interested in, wanting to understand how would they be managed, who would look after them, and also community wanted to make sure that who would get access to these samples. And so this governance structure has been established to make those decisions, because we've, as a part of our ethical process and a part of our consultation, the samples from this study will only be used for the purposes of answering questions about diabetes and their complications, and that this group are the decision makers around how any sub-studies might be undertaken with those samples. Respect for Aboriginal knowledges and systems. So our WellBeing model started off as a chronic disease model, and this was a national study as well that brought in Aboriginal research fellows from across Australia. And so we started off with, kind of really from a deficit perspective, talking about chronic disease. And really what those Aboriginal research fellows said to us was, let's flip this. Let's actually make this about health and wellbeing and come from a strengths-based kind of approach rather than that deficit, analysis and description all the time. And so this study really engaged and listened and changed its approach based on Aboriginal knowledges and what was important to those research fellows that were participating in the study. And so the WellBeing Model came out of that work. And I think Simone touched on this beautifully, but reciprocity or delivering tangible benefits. Our research is underpinned by community priorities, and unless we have a knowledge translation plan at the beginning, and then when we need to deliver tangible benefits to community, and that might mean that we employ community researchers where we can. It might mean that we would reimburse services to release their staff to participate in some of those national studies, for example. So we don't do any research without ensuring that there's a tangible benefit, and that benefit's not determined by us. That is determined by our communities and by our partner organisations about what's important from their perspective. And everything we do has to have a knowledge translation element or plan. So I showed you some images earlier of our communities involved in. So we've been able to influence some policy work in South Australia, particularly a South Australian Aboriginal Cancer Plan, an Aboriginal Diabetes strategy, and a heart and stroke plan. And so the community were very invested in those pieces of work, and they wanted to understand how are we going to influence and ensure that that evidence is translated into practice, because unfortunately our first Aboriginal Cancer Plan in South Australia had a significant implementation failure. And so our communities have continued to be involved in our work, and what we did as a part of our academic translation centre that was established in South Australia was developed the South Australian Aboriginal Chronic Disease Consortium. And what the consortium does is bring all of the key stakeholders across the health system together. And what we aim to do is have shared priorities through our roadmap for action, and are trying to address systematic change and translate our evidence through the Chronic Disease Consortium. So that's one example of how we go about doing that. So it's not always the standard research metrics that might be important from a knowledge translation perspective. It's also about what's important from our community and to be able to influence systemic change. And that's it from me. So thank you. I hope that that's given you a bit of an insight into the work that we do in the Wadley-Paringa Aboriginal Health Research Unit, or the Aboriginal Health Equity theme. And I'll be happy to take some questions a bit later on. So thanks very much.
Thanks, Kim. That was amazing and really covered a whole range of things, but that work on developing principles to underpin how you might conduct Aboriginal health research, and then how that's been implemented in practice, that's really very valuable. And you can see some of those themes continuing both from what Simone has talked about and what you've talked about, and like that willingness to, and not just willingness, but how essential it is that you're listening to community priorities, and the research priorities come from the community, and that you're able to change what you're doing. And you need to change what you're doing if those things don't align with what the community priorities are.
Absolutely. And you'll note that that was 5 years ago, and we're about to kind of recommence another engagement process with our peak body again, to be asking, going back to community saying, right, this is what we've achieved in the last, 5 years in our foundational work. It was a bit longer than that now, but now what, are these still the priorities from a community perspective, and how would you like to inform our work moving forward? So, taking a bit of a stock take on where we've got to and where we need to go next.
Yeah, fantastic, because obviously communities' priorities change, and, over 5 years a lot happens, so that's really another important point.
Absolutely.
And I also really liked your focus on that strengths-based approach, and that can be hard to do, but flipping it around from here are all the problems to here are things that are going well that we want to build on, and that's obviously, that's a really important point. So I'm going to leave the questions to the end. So I do think we have Christine here now. So Christine, if you can join somehow. I know Amanda is going to attempt to enable your camera and unmute you. So I won't introduce Christine until she's online. It would be nice to see her at the same time. And Christine, that's looking like a promising circle with you, but I can't actually see you just yet.
Oh, good.
Are you on camera, or are you just by voice?
I can hear you, thank you, Sian.
Okay, great. Well, look, I'm so very pleased to introduce Christine Corby. So Christine Corby, OAM, is a Gamilaroi woman from northwestern New South Wales. So she's the past chair of the Aboriginal Health and Medical Research Council in New South Wales and is the current and long-standing Chief Executive Officer of the Walgett Aboriginal Medical Service. And for her service to Aboriginal people, Christine was recognised with the Order of Australia Medal in 2005. She's also been awarded the Centenary Medal, the New South Wales Health Hall of Fame Award in Aboriginal Health and Outstanding Aboriginal Leadership at the Women's Out West Awards. But even that doesn't really acknowledge the really amazing contribution that Christine has made to her community. So I'm truly honoured that she's able to join us here today. And I'm just going to pass over to Christine, and there's no camera, so it will just be
Really?
So thanks, Christine.
Thank you. And certainly thank you to all, and particularly the Sax Institute, for giving me the opportunity to put Northwest New South Wales on your research map. I'd certainly pay my respects, elders, past, present and emerging. I am Gamaroi from my mother's family and English from my father. Living in Walgett for some 40 odd years. Research to us in our communities is not as what we believe it to be. Past experiences have shown us back in the 40s, particularly when Aboriginal people were not citizens of this country, the northwest region of New South Wales has been researched from top to toe regarding the way in which we live, the colour of our skin being half caste, quarter caste and all that sort of thing, and having no intelligence whatsoever. So as researchers, I bring the past to you because I think it's important when you undertake research to actually look at what's been conducted over the years in that particular community. For Aboriginal people across the nation, as my fellow colleagues have spoken, it's very sensitive to identify and approach Aboriginal people generically, and you need to be very sensitive to the fact and the way in which Aboriginal people have been treated where you may be conducting your research. I apologise for no visual and I apologise for no PowerPoint, but I will say to you, this is just food for thought when you commence consulting with Aboriginal people. The process has been highlighted previously is so important, cultural language. And whilst I'm Gamaroi, I'm from a particular town, Walgett, Collarenebri, or towns, and Walgett, Gamaroi is the second largest nation in New South Wales. So how we behave and our language is certainly different to Gamaroi people in Tamworth and further afield. So you must be aware of that. We are not generic just because we're in one nation. When conducting research, very essential to consider men's and women's business. Whilst we in New South Wales, we always say, Cook was here first, we're so fair. If they went around the other ports, states and territories, there may be a different story. Because of our fairness, we're assumed that we don't have cultural practices like men's and women's business. We do, and we need to be considered for that separation of cultural practices. Something that concerns me over the years, the remuneration that's afforded by some researchers to conduct surveys, questionnaires to willing participants. If I could say, on some situations I have seen where people are paid and then the researchers are not necessarily told the information they want to receive. In saying that, I mean, on occasions it's difficult to actually extract the correct information because of the cloud of an attraction of being paid. On the other side of the coin, for Aboriginal organisations and people in the community who are willing to and who you partner with to undertake community consultation, I do believe that there must be a training element for the people who are helping you, supporting you as researchers in the community. Through the HMRC, we have always insisted that there be some formal training, a skill set for those individuals, so if they wish to undertake research at a later date, they actually have a skill set left behind by working with you as a researcher. Additionally, those same people, all agencies, must be recognised for their work, not be seen as anonymous and identified as chief investigators. Too often we have seen goodwill left unnoticed, unrecognised, and can be seen as an insult to the integrity of the person that you are working with. Just because they're locals doesn't mean they don't have the intelligence similar to yourselves, because they actually understand about being diplomatic, being sensitive, and being empathetic to the way in which people are hesitant to respond to research, particularly for our area of the state where we've had so much research undertaken about us. Additionally, research can be seen as having conversations with agencies, and unfortunately later on down the track you're actually published and quoted. That in itself can prevent other researchers with goodwill wanting to actually research your community for the right reasons. So please be sympathetic to that as well. For you researchers, remember there have been people on your journey previously, and you must be very aware of the way in which you approach community consultation. You must return consistently. You must respect if people say to you, do not come this week, even though you have a schedule or a calendar to come for the next 6 months. If we as a community or as an individual says to you, please do not come, sorry business, other activities happening, other local community events take precedent, please don't assume that we as community and as individuals aren't interested. Our local circumstances, our local politics, our local society takes precedent over anything and anyone who wants to participate in activities in our community. Again, too often we've seen some people who have been offended by our responses to say, can it be rescheduled? It's out of our hands, circumstances beyond our control, and we just want to be respected for that. The relevance of research must reflect the needs of the community. Please remember that as well. Just because there's money around for research of, and I'll take something that's diabetes. And for us, certainly as Aboriginal people, chronic disease and diabetes is the forefront of our health and well-being. But there may be some communities who do not see that as a priority. They may have another health priority, another social priority. Housing may be an issue, unemployment may be an issue. And if you expect that community to say to you, yes, we want to participate in research, even though it's not our priority, don't be defeated, but try and work with them to see and assist, if you can, to source research that's appropriate to their needs. We as businesses, and you know, I've been at the AMS here for some 30 odd years, we like to encourage research. We believe it's important, but we also believe in the accuracy and the truth. One thing I will say, when you as researchers look at the demographics of a community, I say as an Aboriginal person living in this community for a long time and seeing the way in which census is conducted, not all data recorded by the Australian Bureau of Statistics for a particular community is correct. Some people are very reluctant to disclose their status on the night the census is undertaken, housing, money, you know, all that sort of thing, as we know what census is, because they believe the government will use it at a later date, detrimentally to them. So that in itself, the data is not always accurate you receive from the federal government. Additionally, with the Australian Electoral Commission, we know the results of that too, as people who are enrolled to vote. That in itself is a collection of data for those who are adults in a particular community. We know as Aboriginal people, not all Aboriginal people are registered to vote, again, by fear of government that will use it against them at a later date. So I speak from living in a community, I speak from being involved in with researchers for many years, and I also speak from the history of our communities like Walgett, Brewarrina, Burke, the river towns, where research has been undertaken for many, many years, and unfortunately some researchers use that information as a basis on which they conduct their research. The data and the research that was conducted all those years ago has no bearing on research that's being conducted now. You know, that is really all I can say. I do apologise for the brevity of the talk, and I do apologise that you can't see me. But as an organisation, I do say to you, Google Walgett Aboriginal Medical Service, see what we've achieved as a business, and maybe you might have an interest in coming out to our community and actually working in partnership with us to conduct reports and programs that could help us advocate for the way in which we'd like to deliver our services, not according to the government. But thank you, Sian. Much appreciated. I think I've been timed. So
thank you, Christine. And you absolutely don't need to apologise for any aspect of that. That was really wonderful. And I just noted some of the things that you had said, you know, in that presentation, but again, emphasising the relevance of research that was going to benefit the community. And I guess that's been a theme that's been carried through from both Simone and Kim's talks as well. You also highlighted the importance of recognising local people in the research, not underestimating their skills and experience, and also acknowledging them as partners in that research. And if you're working in a truly co-design way, that they're bringing that wealth of local experience about what's important to the local community and how in what the research means, what sorts of research is useful, and how you might communicate that research to the community. I think your point about respect is just, you can't sort of overestimate the importance of that respectful engagement to ensure that the research that's being done is useful for the community, and the community it benefits from it. So in the bottom line, that's the purpose of the research, is that it will benefit the local community, and that needs to be carried throughout the process. And you talked about building capacity, so not just kind of coming in and doing stuff, but that when research happens, that there is also some strengthening of capabilities within the organisation that the research is being conducted in, so that there is strengthened research capacity, or whatever those particular skills are, through that work. So Christine, I am going to, what we've done with the others is just save the questions for the end. So if that's okay with you, I will introduce Jamie now, and then come back to you for questions after.
Thank you.
Thanks, Christine. And thanks, Jamie, who isn't actually Billy Wong. He's going incognito, but so welcome, Jamie. So Jamie Newman, also extremely honoured to have Jamie joining us today, and it's so good to get the perspective from Aboriginal medical services and from chief executives of those Aboriginal medical services who do just such fundamental work in supporting their communities, and really are at the forefront of health service delivery, but also that engagement with research and the ways that that research might be useful for their communities. So Jamie is a Wiradjuri man, and he's the Chief Executive Officer of the Orange Aboriginal Medical Service. He's been actively involved in Bullingwudji Aboriginal Corporation Health Service since 2004. He's the chairperson of the Orange Aboriginal Land Council, and is a council member at Charles Sturt University. Jamie has over 20 years experience working with Aboriginal communities at a range of levels, including government and non-government sectors. And with that, I will pass over to you. Thank you, Jamie.
Thank you, Sian. Can you hear me?
Yes, I can hear you. Thanks.
Okay, thank you. Thanks, as everybody else has spoken about, and do the traditional protocol and acknowledge country. I'm on Wiradjuri country here in Orange. I'm a Wiradjuri descendant, and pay my respects to elders both past, present and emerging, and pay my respects to all other nations and clans that are participating in this forum. Thanks to Sax for inviting me. Always good opportunity to share information, knowledge and understanding. We have a Wiradjuri word called Yinyamara, which is it means about going slowing and helping others and sharing knowledge. So we're very focused on doing that in our organisation, and research, taking on board what everybody else has said today. Research is critical for our sector, even more so today than ever before. There is history with our organisations and research, and some of that isn't good, but you guys need to hear that. But there's a lot more opportunities now, and I think there's a shift where our people want to be involved in research, and when I talk about our people, I mean our sector. Government now and the influence around funding, resourcing, infrastructure is all based on evidence-based need. The way we get evidence-based need is through our services, but research adds that another level for us, so that we become a more professional organisation. We understand why research has to apply to our organisations, even though our people in community may not understand that. Our job as the health provider and as the health leader in our communities is to be that voice and advocate. So we are very open to research. I understand why some of our services aren't, and we respect that position from services in our sector. But for Orange Aboriginal Medical Service, we've been involved in multiple research projects. We have a great relationship with Sax, currently doing projects with them, have done some in the past, because we know the need is there, and we've invested a lot of time, even though we've had a changeover of staff over many years, that we understand why research is so critical for us. At this point in our journey as an Aboriginal medical service, whether we like it or not, we're competing with other AMSs for funding, for infrastructure or services. We're competing with mainstream for any other additional funding that's out there, and we need to provide evidence that we have researched what we're doing, we have evaluated what we're doing, we have key partners like universities on board with us. If I was to say one word that would encourage you guys to work with AMSs, it's relationship, and we need to build a relationship. We've got to understand of historical issues, we've got to understand of current issues, processes and protocols within community. I would ask you not to feel dismayed if you get rejected by an organisation or a community, and there's probably many reasons behind that, but there's, I would say, even in our region, Central and Far West, that we're more open to discuss research, to understand research, and the research that you're going to be engaged on, most importantly, is what will influence our practice. As I mentioned earlier, evidence-based need is what government are going to fund, and what's even more important is that it influences the practice of our service. So if it's chronic illness, mental health, allied health, whatever the issue may well be, if it influences practice and you have an organisation is willing to work with you, and you have timeframes around getting research in, whether it's applying for it and requiring staff to do the research, I would say to you, work with an AMS, build a relationship, not only at the local level. We have a state affiliate, the Aboriginal Health and Medical Research Council, which gives most of all of the ethics that you guys would require. But being involved with an AMS and an Aboriginal community, there's not an AMS in every community in New South Wales. So working with those communities, understanding the politics of each community as well. Now we have, where there's no AMSs, you might have Aboriginal Land Council or Aboriginal housing co-ops. I'd encourage you to talk to Aboriginal Affairs New South Wales or the National Indigenous Australians agencies, which are in regional centres throughout New South Wales, to find contacts within community, because they're your leverages there to get contact with community, so you build relationship and not just be reactive to whether it's an MRFF opportunity or an NH and MRC opportunity or a government opportunity to do research. Profile opportunities for communities in your patch. So whether you're part of the top 8 university or regional university, get to know your communities. Now, don't be reactive, because one thing that's off-putting for a lot of our services in our communities is people seem to be a reaction to getting money rather than we want to come in and help you with capacity building at your organisation, or understanding research and what research could mean to you in practice, how research could even benefit us in applying for funds, could identify gaps in our services, all those things that we mostly do reactively. We could do it proactively with you working with us. I'd also encourage the universities to think about what other supports the university could provide to our sector. When we work with universities, it's not just working with the researchers and building our capacity. We want to know what other elements the university can provide to our sector. So, you know, might be able to help out with developing submissions. You might be able to help out with clinical support, clinical understanding, clinical training for our teams. That's how you build a relationship. It's not you coming to us and say, oh, look, we've got this opportunity to apply for a grant, and would you like to partner with us because we understand that chronic disease might be prevalent and an issue in your community. But expose to us what other elements within your university could potentially be something that we could access that can support us and answers our relationship. Because what we need to look at is not just a partnership, but it's a relationship that's ongoing. And we've had this with Sax for a while, where now they're comfortable in coming back, and because they built that relationship over many years, is that it's just not a one-off. This is ongoing. This is about building trust and understanding what each other brings to the table. And the greatest win for us, naturally, is that we're able to demonstrate that we have evidence-based need. We've transferred that knowledge around research and literature searches and getting consultation happening and focus groups in our community, because that will influence the practice that we do. And it could be the edge that we have on getting funding that could be open to mainstream, but we would be in a better position because we've got strong university partners. We've got opportunities to evaluate and to do research far greater than what our mainstream competition would be able to do. So understand what that relationship is, not just saying that we're coming into your community to research an element of Aboriginal health, but we want to look at how we build capability within the organisation so that our university, not just our particular faculty, wants to work with Aboriginal medical services, wants to support Aboriginal communities, and wants to see health outcomes eventually. These are the languages that you need to talk about. Consider having a relationship with us, not just a partnership for funding. And if you apply that in practice, as most of the other speakers would have said, it's about coming out and meeting with us. Don't just come out because there's opportunities for funding. Make contact with the AMSs, get in contact with HMRC, find out who's who in the zoo. If there's opportunities in a part of New South Wales, it'd be good for you to do your homework of what's out there, not just the Aboriginal health sector, but as I said earlier, some of our communities, we do not have Aboriginal medical services, but we have land councils, we have other Aboriginal corporations that may well represent that community. And in some places where there isn't those organisations, you have regional bodies. In our patch out in central and far western New South Wales, we have what's called the Three Rivers Regional Assembly. That's formed under the local decision-making strategy under Aboriginal Affairs New South Wales. And in the upper sector where Christine is from is Murray Parky Regional Assembly. You've got those groups there that are there to help you and then can guide you in connection with, if there's an AMS and it's about Aboriginal health, please make contact. And do it before, just so that if you're interested in Aboriginal health, which I would encourage you all to be, not just because there's opportunities to do funding, to do research and to get money, it's about you wanting to know who's in the zoo in our state, in our regions, and who do we go to if there's opportunities that may present itself along that track. Be proactive. We're encouraging, especially in Orange with our university partners, we're taking a strength-based approach, and we know part of that strength-based approach is that we need to be understanding what research is and not be frightened of it, not be fearful of it, but have a relationship with university so that there's wins here for all of us, and most importantly, our people get the greater gain. I'm same as Christine, you can see me. I don't have a presentation. I'd rather talk off the cuff because my passion is Aboriginal health. My passion is Aboriginal people. We want to have functioning Aboriginal medical services that can translate research into practice. So, because the practice is what's going to get us the outcomes that our people deserve. Love doing research now. I'm still learning my understanding of it. I'm learning all the time, irrespective of what university we work with. We've been undertaking, I think, over 10 to 15 research projects, long-term ones and short-term projects, but it still builds our capability. Anything that we learn that can influence practice, that can influence our sustainability, that can influence relationships, and then it can also support us in growth of our organisations. I could say to you honestly that there's probably more gain for our organisation being open for that, and there's more gain for you as researchers or university, doesn't matter whether you're in the top 8 or you're a regional university, there's a lot more gain for you because you understand why we do what we do as Aboriginal Medical Services, and a lot of our communities do lean on us to be that voice for them. Not every community has that infrastructure or that knowledge about research, but we've got to understand the benefit it brings to us. Our organisation here, our board are very happy to be partnering with research. We don't want to overwhelm ourselves. And Christine mentioned about the cultural protocols. If you build a relationship, you'll understand that, and you won't even have to contact us if you understand what our protocols and policies are. You have ongoing relationship. Universities have changeover staff just like AMS, so it's relationship that's constant and consistent that will enable us to work on projects. And there will be wins for you as a university, and we understand that. And there'll be wins for us, and we understand that as well. That's what a relationship is. If it's just win-win for one entity, then it's not a relationship. So don't be fearful of building new relationships with our sector. History is there, but I believe from our first foray into research over 10 years ago, it was daunting with the whole team working with the university on a 715 project, but we learnt a lot, we built relationships, we have better understanding of what our universities want to do, and we access other elements of the university as well. So have that open mind that the universities are a massive entity that can add weight to our sector in other elements, whether it's in capacity building, infrastructure, supports for other funding rounds, grants, connections to corporates. There's a wealth of knowledge you guys have that can add to us, not just the research element. I don't know whether that's my time up, but I'm happy to talk and ask questions later. But we are invested in research, and governments are focusing that on evidence-based research, so evidence-based practice. We are in that mix, and we'd be more than happy to talk to universities, to individual researchers. We've had university students coming here, and we need to be that. We need to be open to have relationships with people that can add to us. And if you can say to an organisation you're going to add to us, the door would be open. Thank you, Sharon.
Thank you, Jamie. And like, again, lots of really very useful and also really very practical suggestions about how to do that work well if you're considering working collaboratively in Aboriginal health research. But again, really, Jamie emphasising the importance of building partnerships and relationships, and some ways that you might do that might not just be to go to an AMS or another service when you need somebody to partner with on a grant. It might be that, but generally you're wanting to build up that understanding of the local community, the context, the protocols, and all of those things. You might do that through supporting writing a submission. You might do that through perhaps some capacity building in other ways. And, you know, there will be a range of ways. And I guess what Jamie is saying is to go and to meet with those communities first. It might be an AMS if there is one in your region, or it might be a land council, it might be another organisation, but some local people who are able to provide you with context. So I am going to now go to the discussion part of our workshop today. So if the speakers are able to make themselves seen, that would be good. And I'm going to also introduce Sandra Bailey, who's going to be joining the panel discussion. So Sandra Bailey will be known to many of you. Sandra is a Yorta Yorta woman, and she is the Senior Advisor in Aboriginal Health at the Sax Institute. But she probably is known to many of you as being the CEO of the New South Wales Aboriginal Health and Medical Research Council for 25 years, which is quite an amazing achievement. So Sandra has served on a number of ministerial advisory committees and boards and been involved in a number of research projects in Aboriginal health, including in the areas of child health and resilience. In recognition of her outstanding service in the Aboriginal health sector, she was awarded the Australian Government Centenary Medal for Contribution to Health and the Hall of Fame Award at the New South Wales Health Aboriginal Health Awards. Again, perhaps just a little slice of the extraordinary work that Sandra has done. So welcome, Sandra. And Sandra, just so I can check, can you speak? So I just know that I've got you on sound as well.
Yes, yes.
Okay.
Yeah, right.
So just for this session, what we'll do is a number of people provided information through the survey ahead of time. So we've drawn some questions from that. So I'm going to ask the panelists some of those questions. If you have additional questions, you can put those in the chat function and we'll keep it across those as well. But my first question for Sandra is, so from your experience, can you share some of your reflections on what is important in working well together? That doesn't necessarily have to be in research, but of course with the context here is research. And I'm wondering if you wanted to share some of your experience about CRIA, and I'll let you talk about that if you're happy to do that and to explain what that is.
Yeah, sure. Cheers. Hi, everybody. I'd like to acknowledge traditional owners of country from wherever all of us are located. I'm on the land of the Gadigal Wongal people, and it's raining very heavily here at the moment. It's really good to see everybody come along, and I'm just so, blown away by those presentations, all of you, and it's really amazing to hear all the great work that's happening, and it's really nice that people have come along to learn more about it. So I think I just wanted to do a bit of a timeline, and I think the relationship is really important. It's a common theme through everything that we're doing and saying here, and we're learning about. And in research, it's really important. So as we've heard, years ago, and probably to some extent still continuing now, is that relationship. And as Christine started with her talk about the relationship and how Aboriginal people, those days were still mission days, some of them, and very heavily characterised by the relationship with welfare and so on, and lack of freedom and so on. In regard to health, the first Aboriginal medical service, so Aboriginal people are becoming mobilised in a lot of areas, and health is one of them. And the first Aboriginal medical service was set up in Redfern in 1971. And if you know now there's over 150 AMSs and a peak body in every state, and NATCHO, which in those days was NAHO, National Aboriginal Islander Health Organisation. So in 1987, a workshop was held, and it was, I think it involved the NH and MRC, NAHO, and I think it was a college of physicians or practitioners or something like that, surgeons it could have been. My memory fails me at this moment. It was a long time ago. The purpose of the meeting was to discuss research and to get some research guidelines around Aboriginal health research. Because some of the things were, as Christine outlined them really well at the start there, of researchers like studying us, not necessarily involving us, not necessarily researching a purpose that's identified by the community, not even really inquiring as to whether this research would be for the benefit of Aboriginal people. Like, will your community benefit? Where the consultations weren't there was no interpretation, no consideration about the what the questions in the research. You know, very important to know, to have a question that relates to something that's going to be of benefit. So for all those issues, and the Aboriginal community at the ACHAs, AMSs through NAHO got together and set up some guidelines. So those guidelines for research into Aboriginal health varied over the years. I think the NHMRC put some out, and then they sort of, in my view, they were watered down a bit in 1992. The HMRC kept sending submissions to NHMRC about those guidelines. But importantly, the AHMRC also set up an ethics committee, the Aboriginal Health Ethics Committee, said a day, that was in 1996, and actually there was a forerunner to that ethics committee, was one that the Redfern AMS had set up informally a few years before that. So the AHMRC has always been onto this issue about research, and for our mob, this has got to be better, and just as there were no health services before the AMS, and that research that had to change, and research has to change, and so now it's nothing about us without us. We all know that one, but it's embodied in so many documents and principles and everything that we've talked of, and we just heard a great a lot of information by speakers, which was really fantastic and really embodies all of those principles that have been fought for over the years. So we've come a long way, and it's all to do with the community, community driven. So I think it was about 2004, the AHMRC and the Sax Institute, Sally Redman at the time, met with the AHMRC to hear about these concerns we had, and also to work out a way of working together. And we set up a coalition for research to improve Aboriginal health, so CRIA, and which is a partnership with the HMRC. Some of the purpose of that was to do with building Aboriginal health research capacity, ensuring engagement, that people engage with communities. We held a few conferences, and then I think the sort of the jewel in the crown was the SEARCH study, which is the study of environment on Aboriginal resilience and child health, which is really, as well as being a really important research study, it's a standout model, for how research should be done in a way that embodies all those principles we've been talking about and the ethical guidelines. So CRIA, through SEARCH with Sax, we learned a lot. It's a great model. It's the quintessential model, if you ask me. It meets all those the ethical guidelines, and we will be hearing about ethics a bit more in the HMRC in the next workshop. So I just think I just wanted to put that historical context there for some who might not know about it, probably all younger, and yeah, what can be achieved together. So that's how our CRIA came about and SEARCH came about, and how this partnership has come about and grown, and we're now able to we're actually doing more projects than that, which are based on the same principles, and it's just been really great to be able to share this background with everybody. But I'm going to step down now and let everybody ask some questions.
Thanks, Sandra. And it's really good to hear that history, and these things don't just start from nothing. There's always those foundation blocks, and you and others on the line, and speakers and others have been instrumental in building those foundation blocks. I think what you said also highlights the importance. Of course, individual people can contribute and be aware and adhere to principles, but having some processes, some structures that support that is really helpful, like having agreement between organisations, and Jamie talked about that as well, but having something bigger just than a person, it does help for some of those things that, you know, going to take a bit of time and need really some longer term support. So thanks for sharing that experience.
There's so much more. Sorry, there's so much more, Sian, but I won't go into it. I mean, it's all those things, you know, trust, respect, and ownership and stuff. So anyway, thank you.
Yes, trust, respect, and ownership. I feel like there's all of those things, and I know people have captured some of these things in writing, but just all of the things that you've all said are really just such important principles and some really practical ways of thinking about how you might implement that. So look, I'm just going to go through some of the other questions that were provided by people ahead of the workshop. So the next one, perhaps Christine, if you are still able to connect, I think I still see you there. So something that a few people raised was sort of like, how do you not get in the way? So knowing how busy Aboriginal medical services are, what are some suggestions that you might have about how you would do that work around working collaboratively in a research project without kind of getting underfoot of very busy people? So I don't know, Christine and Jamie, if either of you have some suggestions for how you might think about, like, what do you do? What advice would you give to an early or mid-career or other researcher about working collaboratively that that didn't make you feel like you were causing more problems?
A gentleman would let a lady go first, so if Christine wants to talk, I'm happy to listen and then add my 2 cents worth, or I'm happy to go if Christine is okay with that as well.
Yeah, she's just coming back on, so you could probably go first.
Okay.
Yeah, she's on. Yep, sorry.
On? Okay. It's back to relationship, Sian, and all people listening. We have to make it a priority as an AMS. We have to be involved in research in some way, shape or form. And, you know, I think the ideal in a U-Butte environment that AMSs would be funded research workers or have a research element within our organisations, that because we need to build our capability in a strength-based approach, that we're not being reactive to university, that it'd be great for AMS to initiate research. Wouldn't that be the ultimate, where we're driving it, where it's coming from us? This is what we want to be able to do. And then we are the partner with the university through a relationship that we've established. And, you know, there are many elements of the university that we don't know about that can form a relationship, and a research project can come from that. But now, if that relationship is built, then AMSs will come to the research, to the institutes and say, we want to be able to initiate some research around this to see how we're tracking, even evaluation of our projects and our programs. So it may not mean millions of dollars, but it builds that relationship and it builds our capability. It would be great for universities to work with us to say, why don't we have research officers in each of the AMSs? That would be the ideal, rather than reactive, that we are, and the way the government's going now, evidence-based need is critical. Us being more open to research, and now that if we're going to be the health voices for our people in community, then we need to lead that as well. I think the strength-based approach is critical. So if we can, ideally, if we could add somebody dedicated to be our research contact at a local level that could even communicate with HMRC, be the link between the universities, so that we're still able to do business, and we want to do business, but we've also got to be diversified in what our business is. So we've had everybody else doing research, but ultimately, and the ideal is that we drive research, and if we can do that and have the expertise in our relationship with our universities, then that's probably the ultimate. But as I said at the start of this, we need to have a focus on research. We need to be able to have really good, strong partners that will be responsive to us, and we can be responsive to them. Because as I said before, there's going to be win-wins here for each entity, but most importantly, our people get the biggest win of all.
Thanks, Jamie. And I guess, yes, obviously you're less likely to be in the way if you're doing something that's important to the medical service. And that's what you're saying, is that, if that's research that you want, you need to know the answers of that so you can be delivering evidence-based programs. Then it's more likely to be that you're not in the way. Sorry, I've just got a message from Amanda saying she can't unmute you, Christine. So that's probably not very helpful. So let me see. I asked her to click in the microphone top right of the screen. So I don't know, does that work for you, Christine, if you can unmute yourself? Sorry about the technical issues, but I think while we're doing that, we might just go to the next question, which is kind of like how you start. So perhaps we've covered some of that off with what speakers have said so far. There's lots of things around how you might start to understand about context and what's important to the local community. But I was going to direct this one to you, Kim. So if you have any idea, any suggestions about what would work about starting to build or to begin engagement with an Aboriginal medical service or another health service.
Sure. I mean, I think that it would pick up on a lot of what was said, and particularly what Jamie was saying about, different communities have different structures. Some have Aboriginal health services, others don't, and that's going to be unique, I think, to the setting in which you're in. I suppose how we went about it in South Australia was we reached out through our peak body to start with, and then, built relationships with our member services through, the Next Steps project, which was asking what are the public health priorities, what are the things that are worrying you. So we started like that. I think you could also, if you had no experience, you could, reach out and maybe think about, setting up an advisory structure, like get some advice, understand the local needs. So, I mean, I don't want to kind of have this rush of researchers going to AHMRC, for example, but, as a peak body, that might be a place to reach out to get some advice. Or I think Jamie mentioned, Aboriginal services, Aboriginal affairs in government might have some leadership. So I think it's about kind of understanding your landscape. What are the kind of local services and within your area, and I think seeking that advice and being proactive. I really liked Jamie's message about being proactive and starting a relationship, building it and maintaining it, not just when funding opportunities or grants are coming up, because we know there's always really short time frames around grants, and then things are being driven by other kind of timelines and priorities rather than an ongoing and established relationship. So I think starting at the start, trying to establish the relationships, getting the advice, local advice from the right people, and building that, I think was a really good advice from Jamie and Christine and others that have spoken about having that ongoing relationship with community.
Great, thanks, Kim. That's a good summary. And I guess with all of these things, there's not just one single thing or one simple thing, but there are often a multitude of ways of finding out the information that you need and starting to find out who the right people are who can help you work out how you begin to build that engagement that is important.
Absolutely.
So I might just go through, so I see we've got another question from somebody on the chat function, but we'll just go through the questions that have come through ahead of time as well. And Christine, it doesn't seem like we're having any success unmuting you, which I'm sorry, I'm not really sure how to address that. The next question is really about what advice you give researchers not to do. So I'm sure you'll have all had experience of researchers doing things that didn't work well for your communities. I know you've covered off on some of those as well in your responses. But I just think it might be worthwhile revisiting some of those things. I know some of the things we've talked about, or you've talked about, include things like just coming when you need money for a grant, or coming in and not understanding the local community. But just, Jamie, because you're on my screen right now, can I address that one to you?
Say that again, sorry.
So what would you advise researchers not to do? So if you're trying to build a relationship, a number of researchers will have come and done things wrong, like as in they will have done things that might have damaged their chances of building a relationship, or either for themselves or for subsequent researchers. So where there's some kind of clear, don't do this sort of things that you would tell researchers.
Number one thing, don't, as best you can be, don't be reactive to funding, because that sets a bad message straight away. Be proactive here. You know, there may be funding available, but you're going to have to build that relationship, that trust, because as Sandra mentioned before, that historical timeline, what Christine's spoken about, and I'm sure Kim and the other speakers spoke about, we can't be rushing into funding for the sake of funding, because the elements of a relationship is ongoing. That's what will create a relationship between you as a researcher and a university with an AMS, is that you're more invested in what we want to do overall, not just for one particular element. Governments are great at doing that, but we would see you as a really strong partner in a lot of ways, rather than just saying, this money's come up, we'd love to put in an application, you're the only AMS that we've heard of, and we get these are common themes from a lot of entities, individuals and or universities. Don't be in a rush to do research for the sake of research, for funding. Be invested in Aboriginal health, because that's what we see as Aboriginal people. Is this person or this entity invested in Aboriginal health? We get too many. This has happened for many, many years of funding's available. That is not a good way to have a relationship. So, you know, take a step back, and you may well be pressured by the university to put in for this and let's compete for this, but you're probably going to have a negative experience, which I would not encourage anybody to have. But let's be a positive experience. You might miss out on that funding round, but you can build a relationship that can open up a lot more opportunities later.
Thanks, Jamie. And did any of the panelists who are able to unmute want to contribute to that? Anything that you would give advice to researchers not to do?
Yep, it's a good question. A few years ago, we started to do a do's and don'ts list. It's quite big, and I think it's I mean, you know, we might do some more with that and circulate some information about that. And you know, Kim's nodding her head, and Jamie as well. These things are all known to us in the sector, and some of it's really some of it's just really making people familiar, you know, and with just even protocols, you know, like welcome to country, acknowledgement of country, and what's the difference, and who can do the welcome to country, and who does the acknowledgement. I mean, it seems like a small thing, but it is important. There are other there's the list is in my mind. I can't recall it all, but it's, you know, just reminding people about cultural respect, how to behave when they're in at an AMS. You know, I think not behave, not in a sort of a mean way, but you know, like what sort of things. So there might be something that a researcher thinks is totally fine, and they might say something out of respect, or they might think it's the right thing to say, but it actually culturally it's not, you know. And it's picking up on those small things that mean a lot, and that those things make the relationship better. You know, our mob starts to feel more comfortable when they don't have to sort those things out anymore. about telling people those things. Welcome to country. As Christine said earlier, which is a great point, you know, if there's sorry business and, you know, meeting can't happen, well, it can't happen. There's quite a few anyway. Now that I've said there's a lot, I can't think of them, but they're there, and I think it'd probably be good at some stage to write them up again. And unless Deanna is online, is she? No. Yeah, to write them up again, you know, be part of the materials that we're able to circulate at times. Yeah.
Yeah, thanks, Sandra. And look, I think, of course, we're trying to focus on what you should do, but a number of people have you know, raised that there's stuff that they just are not quite sure about, and they don't really know where to begin, and they're worried about doing the wrong thing. Yeah. And you know, I think that a lot of the guidance that's been given today will, you know, encourage people through learning about the community, through learning all of the processes, protocols, you know, the context that will help to do the right thing, rather than so much worried about doing the wrong thing, that you're kind of understanding the community and you're sort of more likely to be making the right decisions.
Yeah.
I'm mindful of the time and that we're rapidly coming up to the end of our 2 hours. So I think perhaps we might just take the question from the chat function, which is, do you have any suggestions for how Indigenous data sovereignty and governance can be built into these collaborative research projects with communities? And Kim, I'm wondering if that's something that you might be able to share.
Sure, and Jamie's responded as well, which I think is an excellent suggestion about discussing things locally and having, you know, joint agreements between researchers and universities and community, and having procedures and policies in place. How we've managed that in the South Australian context is that we have set up a technical kind of governance structure of people that, you know, might be data custodians, understand data, but with Aboriginal leaders. And then we've also had like Aboriginal community with Aboriginal leaders to provide that cultural overlay to help determine what are the questions we want to answer from, you know, particularly registry data and things like that. And also to provide that oversight to those landscapes that we've developed across the state. And then Dr. Odette Pearson, who looks after that program of work, has then worked with individual communities about how those communities might want to utilise that data, and haven't made it available publicly without the permission of that local community. And so the community determines how the data will be used, whether it's for their own internal purposes as an evidence base to, you know, leverage either funding or program responses, or if or to even compare how they're travelling with, you know, communities that might be of a similar size or similar, you know, cultural relationships. But it's really the local community that decides that, and we do that various ways through our community councils. We have got some regional bodies as well in South Australia, not as many potentially as New South Wales, but we do have some regional bodies, but utilising existing Aboriginal governance structures to determine how the data is then used, and then putting the control back in the community's hands. So that's how we've, you know, tried to manage that in the South Australian context. And there's still much more work to be done around our child health data, and particularly in the ageing space. We've got a large registry of ageing data in South Australia, and we're just beginning that journey.
Fantastic, thank you. Jamie, did you want to add to
that? Yeah, Sharon. Well, look, I think it's critical that we have data sovereignty governance established within in our own organisations. So having an individual that is a research officer based at NAMES would be ideal, but you need that other, and we would say potentially could be a cultural advisory committee that could take on that function and work with the university or the researcher. We'd always go back to HMRC and NATO around guidance for that as well, because you'd want, if you have a relationship, then you can share that between the university and say this is what our responsibilities are to our people around data sovereignty and governance, and how we protect that, and why we're the advocates for our people, because people in community would have some apprehension around access to their data, which was shared earlier around our lack of participation in the census and enrolling to vote. But we also got to be, our job is to inform our communities about the importance of being in the census and enrolling to vote, because there's the voice for them. The voice that could get us more funding as an organisation if our real data around Aboriginal people that live in Orange was accurate. We have estimates that the census isn't, we're not fully participating, so we're getting funded because the census says we have 1,700 Aboriginal people in Orange. We know we have nearly 4,000. So our job is to work with our community about their participation, because it brings benefit to us, which in turn is benefit to them. So more infrastructure, more services, more people employed, more ability to provide a range of other services. So understanding that we have the final say, because we advocate for our people. Our people who hand over that, their data, their trust in us, because reputationally we can't afford to take a hit with that. You know, so that our people, our clients, our community would expect us to be able to say, we've done this. This is collectively how we've done it. We've ticked all the boxes in. We get it overseen by HMRC and NATO, and they provide advice. We even have our own legal people to look at it, so that we would have this before we even sign on a project with any university, that these things are done. But we could have a framework around with working with our university partners on data, sovereignty and governance. But some of us haven't done that because we're not in that space yet, with working in a relationship with universities and or researchers. So this could add to our organisations.
Thank you, Jamie. And Simone has just popped up with the little one, who I take it means that he didn't go down for a nap. But look, I won't ask you more questions, Simone. Just I'm going to wrap up the session now. I just really wanted to thank, firstly, all of our participants for joining, and really appreciate taking time out of their days. But particularly, I wanted to thank our speakers. So Simone, Sharif, and Kai, of course, thank you, and Christine Corby, Kim Morey, Jamie Newman, and Sandra Bailey. Also, I'd like to thank the Aboriginal Health team at the Sax Institute, because they did support some sort of last-minute arrangements, including Carmel Cook, who was on standby should Simone's little one not have been amenable to her presenting during this forum. And thanks to others at the Sax, including Amanda Dominello, who've helped organise this and make it all work. Look, for the next workshop, we're planning to have to build on this. This was intended to be it's a workshop that looked at the underpinning principles, sort of an introduction to working in Aboriginal health research. For the next workshop, we were thinking about focusing on more of the doing, how you process ethics applications, and perhaps looking at some research methodologies that have been used with effect in working in Aboriginal communities. But we'd be really interested in your feedback as well about what you think might be useful. So you have on the screen now, for those who can see the screen, my details. You also have Amanda's and Sandra Bailey's details, so do feel free to send through any suggestions, either for the next workshop, or there might be other workshops as well where we can build on this work from today. So I'm going to just close with that and thank everybody for joining, and hope everybody is dry where they are, and everybody who has been affected by the floods, I hope that that's able to be cleaned up soon and you're getting your power back on shortly. So thanks everybody, and look forward to chatting to you again.